Okay. Please go ahead, introduce yourself, and everyone that speaks needs to introduce themselves first. Okay.
Very fine. Thank you so much for giving us this time. My name is Candy Birch. I'm a board member of Medicare for All Florida, and I'm here with these wonderful medical students who are representative of the Students for a National Health Program, and we are also co-sponsored by the Alachua County Labor Coalition. And so I just want to tell you how excited I am that these young people are here to show you how passionate they are about affordable and accessible universal health care, cradle to grave. So we'll start with Artenisa.
Hi, good morning. My name is Artenisa Kula. I'm a third-year medical student here at UF. So I'd like to start this presentation just with a quick story. Growing up in Florida as a low-income immigrant, my family, like many others in the state, could not afford medical insurance. It did not qualify for Medicaid. The repercussions of these policy decisions had a significant impact on my family. About a decade ago, my father was diagnosed with stomach cancer through a free clinic, the only option for reliable care. As a young child, I watched him waste away, throwing up after every meal and losing more weight than he could keep on. While my father was one of the lucky ones and eventually received the medical care that he needed, I often wonder how different his story would have been if he had health insurance coverage to see a doctor sooner, to escape the mountain of medical debt and the lost wages he dealt with after the fact. One thing is for sure, from my experience as his daughter and a medical student, his experience is not unique.
So, hey, my name is Pat. I'm a medical student also at the University of Florida. So, going through Medicare for All. So, does Alachua have a health insurance problem? So, almost half of people in Alachua County are either uninsured or underinsured, causing restrictions in their ability to get recommended care. On a broader scale, nearly half of all people have problems paying their insurance. Nearly a third are not able to pay surprise bills, and nearly a third can't take their prescribed medication due to out-of-pocket costs. The bottom line is that a large proportion of Americans are sick and vulnerable while health insurance companies profit. So it is no surprise that polls show that over 60% of Americans support universal health care.
Hello, I'm Heather McDougall. I'm a second-year medical student at the University of Florida. So healthcare is a complicated issue, right? Other countries have to be having this same problem. But when you actually look at the data, we are spending twice as much compared to comparable wealthy countries, despite these countries covering everyone. And if we're spending more and covering less, we must be paying for better healthcare, right? Well, actually, when you compare the US to these countries, we're doing worse than them in important metrics, such as life expectancy and infant mortality. Somehow we're paying twice as much, providing health insurance to less, and getting even worse healthcare. So, the trillion-dollar question to ask ourselves to figure out why we're spending more and getting less, ultimately is where is our money going? When we compare what we're doing with other countries, we can trace this trillion-dollar discrepancy to health insurance administration. We treat healthcare like a business with the idea that competition will drive down prices. However, in reality, treating healthcare like a business is actually raising prices, with large administration overhead taking in nearly 35% of our total healthcare spending. The reason why our overhead is so much more than these other countries is that every insurance company rakes in profits over our poor health and are incentivized to charge more and cover less. And hospitals and clinics are required to hire these small armies of billing coders to negotiate with each of these individual insurance companies. So given that we're spending more than a third of our healthcare on these bloated administrative costs, is there a system that we could implement that transfers healthcare spending from profiteers to people?
So we've shown that we're paying more for less to fund a bloated healthcare system. What's the solution? Well, the answer is Medicare for All. The plan is that first, by making government the sole provider of healthcare, we would eliminate administrative costs from 30% to 5%, and second, we can use those savings as well as other sources of funding to support comprehensive health insurance to every person in the United States. This means, for you, no more surprise medical bills, freedom to change doctors and choose hospitals, no more holding off going to the doctor for fear of your bill, and according to the Congressional Budgeting Office, for the average American, higher wages, increased disposable income, and improved health and longevity.
My name is Kenneth Davis. I'm a medical student at the University of Florida. And according to the documentation we submitted, Northwest County residents live an average of 81.6 years, which is higher than the national average of 78.7 years. However, African Americans living in northeast and southeast parts of the county live an average of just 73 years, which is almost 9 years shorter. As we speak, there are 29 full-time and 4 part-time facilities in West Gainesville, but there are only 3 full-time and 9 part-time health facilities in East Gainesville. So this question is what are the numbers that in this graph here? Can we turn this here? Americans, they're very understandably skeptical on new government programs, and at this point you might be asking, is this really going to cover everyone? If you don't believe us, read the bill. This is a non-discrimination clause, and this would prohibit any discrimination in several different facets. Instead of reading this whole clause, we want to talk about some specific groups that would be protected under Medicare for All at the federal level.
All right, my name is Ashrita. Like my colleagues, a medical student at UF. Sexual and gender minorities are identified as a health disparity population by the National Institute of Health. They are more likely to delay health care, less likely to have a usual source of care, and they're also more likely to be worried about health care bills than their heterosexual or their cisgender counterparts. So as it stands, LGBTQ individuals are more likely to be covered by Medicare in the state of Florida. And I'm sure that many of us have heard about that LGBTQ individuals have been subject to recent state-level restrictions on their health care. Many individuals that I know personally are having a hard time accessing gender-affirming care and are even considering leaving the state of Florida so that they can have access to this vital care. So the non-discrimination clause that we mentioned in the slide before would allow for LGBTQ care protections.
So we have a bunch more, but we're just going to go really fast. This one has to do with reproductive health, and so I just in the interest of time, what we know is that Alachua Countyans can really benefit. The poor, people of color, uninsured, the young, and even businesses will actually benefit from this. And so we feel like 95% of Americans will actually save money when you bring in premiums, co-pays, and deductibles. So we thank you so much. Thank you.
Thank you, and I appreciate the time that you guys took to come down here. I understand this is finals week, so thank you for taking the time to do this. And can I get a motion to approve? Second. All right. Is there any comment to the motion? Seeing none, all in favor of the resolution, please signify by saying aye.
Aye.
Any opposed? Okay. The motion passes. Congratulations. We are happy to support Medicare for All. And if we can we get a picture real quick? That'd be great. Yeah, okay. Takumi indicated she was ready to do that. So, Paul, if you want to come over here real quick.
We'll be fast.
Do you want all the commission or just you guys? Or do you want to do it in front of the commission?
Whatever you want us to do, where would be the best for you?
I'll ask Takumi.
Just do it there with the chair.
Okay.
I tell you what, I'm just glad to see there are young people still willing to put that much time into an education. You know, that's a lot of commitment. I love the sand hills.
LCB. I'm like so happy that people are actually stepping up.
Oh, me too.
We've got good people.
Mm-hmm. We do.
Good stuff. Okay.
It was an absolute honor to sponsor that resolution.